And I'm really pleased to introduce 4 amazing abstract presentations that we're going to hear from next. So these are colleagues across both primary and secondary care who've done some amazing work using pseudoscience to improve things within their settings for patients. So we're going to kick off with Jess Barton to start with. So I'll invite you up to the stage to introduce yourself and start your presentation. Thank you.
Hi, good morning. My name's Jess Barton. I'm the lead Cancer Faster Diagnosis in Somerset, and I'm going to talk to you today about the use of self-referral in the earlier detection of cancer. But I want to just start off by just doing a background about why I'm here today and why I'm so passionate about this, the services. Pre this job, I was a nurse practitioner working in our acute surgical assessment unit, seeing patients from A&E and GPs who were querying sort of acute surgical conditions. I met a young 30-year-old lady who came in with 2-month history of lower abdominal pain. She hadn't sought any medical attention until that morning when her GP saw her and wanted to rule out appendicitis. So she came in, I saw her, I did all the relevant investigations, bloods, ultrasounds, which all came back normal. I got my consultant to see her because I wasn't quite convinced about what was happening to her. Consultant saw her and was like, not sure, send her on her way, and if she can come back if she has any problems. 24 hours, she came back with worsening abdominal pain, saw the overnight surgical team, still didn't know what to do with her. 24 hours later, she eventually got a CT scan. That CT scan showed that she had a right-sided colorectal cancer that was obstructing her bowel. 6 months later, she died. She was only 31 when she died, and if she had managed to access healthcare earlier, she should still, hopefully she still would have been here and been with her kids. Oh, I need to press the clicker, sorry. That's that. So, it's a bit old now, but in 2019, NHS England's long-term plan outlined an ambition that by 2028, 75% of all cancers were diagnosed at stage 1 to 2. However, in Somerset, we found that only just over 50% were being diagnosed with early stage cancer. And we thought this wasn't good enough, and we thought patients of Somerset deserve better. So we started off by taking a closer look at 3 specialities and looking at what was the actual problems. And we started off with postmenopausal bleeding, which in 2023, we found that patients were waiting average 63 days from the point of contacting their GP to actually seeing a specialist. So we launched the Bleeding After Menopause service, a first of its kind in the UK, which uses See My Signs, a self-referral pathway, digital self-assessment forms, and the forms ask key questions based on algorithms to assess eligibility. Patients who are ineligible are promptly signposted back to their GP and actively prompted to see them. All completed assessments are added to the centralised dashboard, which is monitored by our admin teams who coordinate the next steps in their pathway. And we launched in 2023 in October with a one-stop clinic with an ultrasound and clinical assessment, which are offered in 7 locations around Somerset. So patients didn't have to come to their major hospital, which can be over an hour away in Somerset. We advertise using social media, local TV and radio campaigns, as well as GP text messaging, which we've actually found to be the biggest sort of impact in getting patients in. So far, we've had 776 referrals, 33 cancers diagnosed, 26 days of GP time saved, and now it only takes 7 days to be seen by a specialist, 18 days to get a tissue diagnosis, and 61 days to start treatment. And when we found out more about those who were completing the self-referrals, we found that over 50% of those were living in the lower deprivation quintiles of Somerset. So we were able to see that we were getting to those hard-to-reach patients that wouldn't normally have accessed healthcare. So we thought, okay, well, we've done this with the bleeding after menopause. What could we do next? What's our next speciality? So we looked into colorectal, and we found that 70% of patients under 50 were being diagnosed at a late stage bowel cancer, and out of those, 54% were diagnosed through the emergency route, like my young patient. And so using the same model as the bleeding after menopause service, we launched the Somerset Bowel service in October 2024. And we started off with just one local PCN with the highest incidence of colorectal cancer with the highest deprivation. And we decided one PCN to start with because there were some concerns about endoscopy capacity, and so we wanted just to make sure that the concept worked before we rolled it out across the county. And patients needed to be the age of between 40 and 49 because we know that after 50 you're invited for bowel screening, so we're not able, those patients are already sort of captured. And patients needed to have bowel cancer symptoms, change in bowel habit, abdominal pain, weight loss they can't explain, rectal bleeding. And we excluded things like anal masses because we wanted them to be actually seen by somebody before they come in. And those patients who met the criteria were given a fit test, and they could either pick that up from their local community hubs or posted through the post. And so far, we've seen 220 referrals, 82% have returned their fit test, 15% have had a positive fit test, and now on average it takes 15 days to complete the colonoscopy. And out of interest, out of those patients who go on to have a colonoscopy, we found that 47% we found high-risk findings, so polyps that need further surveillance, and which sort of interprets that we are capturing these patients before they get to their screening age, potentially suggesting that we're doing some sort of prevention. And again, this was the first of its kind in the UK, so we're really proud that what we've achieved in Somerset. And I'm very much a general surgical person, so colorectal was my sort of thing, and I was really passionate to be part of that service. So we moved on to lung, and we found that in lung cancer, only 28% of patients were diagnosed with cancer had an active treatment with a curative intent in 2024. So we looked at what was being done already in the country, and we found that Leeds and Manchester were already offering this service, which was a self-referral chest x-ray. So we launched the Somerset chest x-ray service in May 2025. So we're only sort of 6 weeks in. And patients aged over 40, were able to self-refer for a chest x-ray. Again, we started in one local PCN to make sure that we didn't put too much demand on our radiology department. And they're invited to attend their local diagnostic centres for a chest x-ray. So far, we've had 12 referrals accepted, 50% having been attended for their chest x-ray, and 1 confirmed lung cancer. I've actually got 2 as of this morning. So we know that we're getting to those patients earlier, and they're able to see somebody really quickly. So rounding that up, we've had sort of just under 1,500 patients refer, 34, possibly 35 patients diagnosed, 974 patients reassured earlier. 98% of patients are extremely satisfied with the services that we're providing. We're bridging that gap between secondary care and the community. Patients but they like the fact that they can do it in their own time, they don't have to see anybody, and they can just do it in their leisure, especially for those younger patients who don't have time to go and see their GPs and things. So going forward, we know that this is just the tip of the iceberg. We need to do more. We need to see more. We need to get out into the communities and speak to patients. We need to tell them what services are available to them across Somerset. We need to make sure that we've got the services across Somerset for now. And our aim is by the end of the year that both colorectal and lung will be available to everybody in Somerset. We need to continue our community and professional engagement. We've just started work with a complex care GP in Somerset to try and get to those really hard to reach patients that don't access healthcare and that we know will present late if they don't access it. And as we grow and as we get bigger, we need to have continuous feedback and improvement, and we do regular PDSA cycles to make sure we're doing the right thing for our patients for Somerset. So we know it works. We're the first in the country. We're doing this. We know we found cancer and we're finding it earlier. We've reduced the workload for GPs, but we haven't increased the workload for secondary care. We've been able to improve the access to healthcare in those deprived areas, and we've also intercepted precancerous changes earlier, suggesting prevention. Thank you very much.
So thank you to Jess. I'm sure you can all agree that was an excellent start to our set of presentations. So we have got a couple of minutes for questions. If anyone has any for Jess, just put your hand up. One over there.
That was amazing, Jess, so thank you so much. I'm privileged that I live in Somerset, so that's great that I have access to these kind of wealth of opportunities. How much did See the Signs play a part in where you've come from now?
Massively. So they've basically created our referral form, they created our centralised dashboard that our admin teams work, and without them we wouldn't have been able to have launched any of this. And the fact that it's so user-friendly, patients, it's been a huge, without them we wouldn't have been able to have done this at all. So yeah, huge